Hello, uh, I'm Booker Thomas, and as you all know, I'll be retiring at the end of this week. It's been a great journey for me here at HealthNet. I've enjoyed every bit of the 13 years that I've been here and appreciate all of the work that each and every one of you have given to this organization. Jimmy Brown will be succeeding me as the new president and CEO, and I've had a couple weeks to spend with him, and I can assure you all that he will be a good fit for this organization. We think alike, we have the same kind of personality and character. He's a good listener, and I feel good about leaving the reins of this organization in Jimmy's hands. One is our strategic alliance with IU Health, especially as we move forward into the future with healthcare reform. IU Health is an excellent partner for HealthNet. They're very supportive. They support our mission. Their mission mirrors our mission, and the partnership that we've been able to establish, I'm really excited about it. Second, I would think would be the expansion of our new facilities, construction and expansion of our new facilities to be able to provide access to more residents of Indianapolis as we move forward in the future. That was a big undertaking, as you know, and I think we have some excellent facilities as a result of it. The implementation of the electronic medical records really puts us in the forefront of new technology and the way that medical care is practiced today is another one. I think also the integration of primary care and behavioral health is something that I'm really is excited about as we move forward in the future. Now our patients will be able to be seen as a whole person in terms of their mental and physical being, and the doctors and nurses working together to address their mental, behavioral, and primary care needs. And then the other one is just aligning the salaries and wages of our staff, our doctors and nurses and support staff, with IU Health's wage scales. That's been a big a step for us. It's been very costly for us, but it's been a good step for us because now we're able to keep our good employees. I see HealthNet moving forward in the future, providing more access to quality health care for people who are uninsured and underinsured and don't have the financial ability to pay for health care services. I can see us strategically aligning ourselves with the IU health systems and the hospitals as accountable care is implemented. And you have to have a good healthcare partner, and I think IU Health will be that partner for us. And I just see us continue to do the good things that we're currently doing. Well, words of advice, since Jimmy is coming to us to HealthNet with a lot of healthcare experience, a lot of leadership experience, there's not an awful lot I can tell Jimmy about leading this organization. Uh, I could tell him to always look at the big picture and don't get caught up in small details and minutia, and just continue revisiting the mission and vision of the HealthNet organization, and never to say no before you really look at the big picture.
Oh, well, first I'll say it's been really, really exciting just being with Booker to get to understand the HealthNet and more importantly the Indianapolis. And when I talk about Indianapolis, that is all of our HealthNet partners. And so that's been real exciting as I've worked my way through the system. We're not nearly where we need to be right now, but it's been just really, really, really enjoyable. But more importantly for me, just witnessing the high respect and regards that this community and the organization has for Booker as the leader of HealthNet and for HealthNet itself. I will say that Booker has left a clear roadmap. And what I mean by that is that the infrastructure is in place. There are a number of future opportunities that are in place. We just have to execute them. And I say all that to say that my vision of building HealthNet is just to continue to build on the solid foundation that Booker Thomas has laid for this organization. And of course there will be new things that we'll be doing in the future, but for right now our plates are full just to implement and execute the many opportunities that Booker and this team have already put in place. Well, absolutely. First off, for Booker, I will say, and I said it again, Booker is highly regarded in the FQHC work environment nationally. And when I say that HealthNet has this reputation in the world that we work in, and that's all because of Booker's leadership, dedication, devotion, and commitment to the mission and vision of HealthNet. And so, first of all, I will say to Booker is that he has done a tremendous job in leading this organization, and more importantly, has now made it very easy for me to come in and to step into those big shoes of his, because the footprints are already in the sand. All I have to do is just follow them. And then I mean we, the HealthNet family. And to the HealthNet, what I'll say is that we have such a wonderful opportunity to continue the legacy. And again, we will continue to serve the patients with dignity and respect. We're going to be customer focused, and more importantly, we're going to stay true to the vision, mission, and values of HealthNet, and that was started by Dr. Benson, and now Booker has done for the last 13 years, and I've only been here for 3 weeks, and we're going to continue in the same vein. So we're excited, business as usual, and let's continue to move forward.
That I would just like to say that the employees, the providers and staff, nurses of HealthNet has done a tremendous job in providing healthcare services to so many people in this community. You probably don't realize the impact that you're having with so many people in this community, and because of you, many people are much healthier and living real good lives today because of all the things that we do as an organization. So I'm just happy to have been a part of this organization, and I will always keep you in my heart.